Paul,
Thank you.
Bill, Linda, and Rachel.
And a second. Thank you, Rob. Could I also get permission to, and I'll sideline that motion for a second one up there. Paul,
Bill, Linda, and Rob.
Phil, Linda, and
Oh,
Rob.
Rob's here. No,
Rachel.
The other RR.
The R's.
Rachel,
Two
sorry,
RRs,
Rob.
right?
Yes.
Paul, Phil, Linda, and Rachel. Motion to
Yeah.
let them in on the phone. Thank you, Mr. Renault. A second. Thank you, Dr. Blair. All those in favor of the phone permission, please say aye.
Aye.
Any opposed? We'll record that as unanimous. Back to the minutes on the floor. Any additions or corrections? Hello, clerk. All those in favor, then please say aye.
Aye.
Aye. Aye.
Any opposed? Same sign. Thank you. We'll record that as unanimous. We'll begin with informational items. Mr. Sorrell, do you want to cover any of these?
First three, Mr. Chairman, they're pretty straightforward. There is no report from the county auditor in your packet, so nothing to report there. They're two typical. I would like to call attention to the last two bold items that are informational. The first being investment in Justine Peterson. For those of you that were on the board and recall, in late 2019, before the pandemic hit, you approved a resolution to invest $100,000 with Justine Peterson to create a loan loss reserve fund, and due to a variety of reasons, including the pandemic, we never actually fully executed that agreement, so those dollars have never been spent. Meanwhile, Justine Peterson has been continuing to work in our community, and in the last, I would say, year and a half, they have seen a significant increase in their local activity. They came back to us and said, we'd like to reboot this conversation, but based on the success that they're having, they would like to look at making that a $200,000 commitment. Of that $200,000, $150,000 would go to the loan loss reserve fund. That would leverage $750,000 in private bank financing, and then the remaining $50,000 of our contribution would go towards technical support, outreach, and on the ground staffing here in the community. This is not an action item today. I'm just providing some information and maybe looking for a consensus. If there is a consensus, we'd look to try and bring this forward for the May board meeting. I would recommend that the source of funds be our CDAP fund, which was where we allocated the money originally in 2019. The CDAP fund balance is such that we can easily accommodate that investment should the board want to do that.
Wasn't this from a discussion about 4 years ago?
Yes, sir. You and I
Phil.
Hang on.
Joined.
Welcome, Phil. Anybody got a problem with Phil being in the meeting? We'll add him in. Can I get a motion? 1 and 2. So I got Rob and Dr. Blair on that. All those in favor of Phil joining?
Aye.
All right, Phil, you're in. So
Thank you.
this was an intergovernmental agreement we signed with the city. Have they not executed any part of entering the marketplace since then?
So they have been actively working. We just never got to a place where we consummated our contractual relationship with Justine Peterson, and therefore we never spent our money with them.
So
They continue to
there's
work.
a window somewhere in town where people can go get help from Justine Peterson?
There is.
And where would that be?
Currently, that's a great question.
Denise Moore, is that
I think
right?
it's Denise Moore.
Yes.
Minority business.
So the
Minority
Minority
Business
Business Development
Development
Center.
Okay, so now what they're doing, follow me on this, folks. Now what they're doing is coming back and asking for an increase in the funding.
Yes.
All right, when they haven't used the first tranche of it. That would also be yes.
Correct.
Okay, because there is no intergovernmental agreement.
Correct.
Okay. So we probably need to work on this a little bit, make it a little bit cleaner for this committee, because they were beating down our doors to sign up for this 4 years ago, 5 years ago. And it's a lot curious to me that it was never implemented because the need was so heavily validated. I see people nodding their heads. I don't know if you were around then or not, but this was the talk of tavern, if you will, the amount of success that particular organization had achieved nationally in the markets they chose to invest in a loan helper program. So, Dr. Clare.
My memory, though, is that the vote happened right before the lockdown. Is that right?
February of 20 is when it was approved. February
So
20.
it was more that lots of stuff happened right then. That is why it didn't work. That's my understanding.
The original conversation is older than February.
Oh yeah, but that's when the vote
Correct.
was.
Correct. Your authorization, the board's authorization, and the appropriation of the dollars was at the February 2020 board meeting.
Okay. So that's helpful too.
And I know they've been doing stuff here. We just haven't been involved with it.
So, are you familiar with how the city invested then?
I am not. I don't know.
And
If you know, Scott.
Are we being asked to do this through an intergovernmental agreement, or this is a separate agreement between the county of Peoria and the organization?
Separate agreement between us and Justine Peterson.
But Scott, remind me, this leverage is like another $750,000.
Yes, that's correct.
Can we request that they come in and give us an update as to how successful they've been?
Yes. And my apologies, I actually put the wrong agenda briefing in the packet. I gave the wrong one to Jan.
Yeah, it's from January.
That one's that's the one that went to committee in January of 2020, not the one I wrote up for today's meeting. And I'm quickly looking for it in my files here.
Scott, you report it to me.
Once I find it, I will. Well, either way, we'll find it and we'll send it out to everybody.
Okay, good. Any other comments from members on this? I remember we really had to do a deep lift to do this for the city. It was not always a popular discussion when we were working on it back a few years ago. So what I don't want is the lack of result to pepper a fresh review. Okay, so moving on. Smart Start dashboard.
Yes. Member Blair is going to take that.
So you may remember that I gave a report to you guys last month. I've lost all sense of time, but while talking to the Committee for Entrepreneurship and Small Business Development, as we talked about this passport program, a couple people on the committee as well as other members of the community came to me and said we had a local venture that could help us with this. For those of you on the health committee, you'll have heard of Beth Kreider talking about that that program where if the police come because of a violent act at a person's house, it reports to the school, and so that student can get help. It's this company, Lifting Up, who created that platform. This program actually went through this Smart Start dashboard that they have, went through the Brave Start accelerator program at the SBDC. So it has had some validation, et cetera. So we have met with them. They have presented to both Scott and I and then to our committee their platform. So this would be an online platform. It's incredibly intuitive that helps entrepreneurs figure out, okay, I want to start a business. What do I need to do next? And some of the pieces of it include, you know, it'll ask you kind of where you're at in your business. And then it'll say, okay, have you met with a lawyer yet? And if the answer is no, it'll see if you need to, and then it'll help you find local lawyers that can be generated through the Peoria Chamber or something else. And basically you can hit that and go through it. They're going to work with us on a portion then that allows us to stamp. So people like Eric Sampson at the SBDC, once he's seen them and taken them through a validation process, can basically put a digital stamp on it that says, yeah, this person has an idea that's been validated, thus giving them kind of a credential then. At the end, we would like a digital credential, something they could put on LinkedIn or other things that says, yeah, I've gone through this program, so my idea is not terrible. I can never promise success, right? But I can always promise less failure, I guess is the best way to put it, or at least cheaper failure. Another thing to think about with this is that if I go through this and come up with, boy, my idea is terrible, I've saved a lot of money and time than to actually get that out on the market and find out my idea is terrible. And that's also good to our taxpayers to figure that out. So the expense, the initial expense is $28,000 with lifting up, and then $25,000 a year is what we're looking at, right, for 3 years. We're, again, much like the last one, we're kind of seeking a consensus to go on to the board meeting in May for this. I think it's a great opportunity. We're helping local entrepreneurs who have developed this. They have already developed relationships with the Morton Chamber and the Muscatine, Iowa Chamber. And this is just a great opportunity for entrepreneurs at early stages to be able to help them get through the process so that they know kind of where they are and where they needed to go next. And it would work for both. I'm starting up, a lawn mowing service to I'm starting up a scalable business, something that could grow and be big. Was that clear? What did I miss, Scott?
I would say source of funds.
Oh.
I would recommend that this come out of the $200,000 you appropriated for small business initiatives this year of ARPA funding. So it comes out of the small business bucket of ARPA funding.
Which makes sense to me.
So reading this, so does this go onto the website that you were talking about creating, or?
Yeah.
Because this is where it gets a little confusing in here. It talks about chambers using it. We're not paying to have Peoria Chamber use this, right?
No,
No. The contract is with Lifting Up.
Yeah.
Or would be.
And so we will have our own site hosting.
Yes.
We're not paying.
We're not sending them over to Morton.
Private entity to use this.
No.
I'm just following where it says these other chambers are using it on theirs and it's user fee driven. I'm just making sure that we're not paying for it to go, whereas the chamber was doing it, they should be paying for it themselves.
No, we are going to have some kind of landing site, I believe, from our website, so that we can be kind of one entity to support local entrepreneurs. It also supports local advisors and mentors, right? So not only organizations like Distillery Labs and the Small Business Development Center, but local lawyers, accountants, branding people, insurance agents who are willing to work with startups. So.
And you might have mentioned it in the last one, but has your group created like a working budget of what this is going to cost a year for, like, if you create this website and you have to boost it or have data tracking, that all costs money, so where's the money going to pay for all that?
So the initial startup cost of 28 is to build it. Year 2 and year 3 are each 25,000. In terms of marketing the site, that would fall under our own separate marketing components that we use, the social media feeds that we already maintain. If we would want to do a little boosting in any one of those platforms, that we have money built into our budget for any variety of reasons. We might do that throughout the course of the year, so that would just be one of those.
Yeah, and again, the idea is that Peoria County can be kind of a neutral member of this. All the other organizations have metrics that would put them into fighting against each other as to who might get what entrepreneur. And if we're in control of this, then everyone can use it. But this also provides a back end, right, of data analytics, so that local groups can then help track where are people in the process, where are how many people have we helped, et cetera, and that may be even more valuable, both to us and to our partners than the front end that the entrepreneurs see.
Thank you for that question, Jimmy. Other questions? Do you see hot links to this from, let's just say, the MAC Chamber of Commerce, Peoria, Greater Peoria Chamber of Commerce?
Yeah, I think this can be incredibly valuable to all members of our ecosystem as a place for everyone to get started, because it helps drive people towards these groups as well. We've also looked at, if you get a certain, distance into it, you might get something like a 6-month membership to the Nest or to a Chamber of Commerce, that those providers provide, and then as well as we can announce events on there and things like that. Like get-togethers, hackathons, things like that.
For some reason, hackathon doesn't seem.
That's a thing in my business,
Okay.
sir. That's a thing in my business.
Okay. Mr. Ricker.
Just maybe additional piece. You talked about, I like the concept of connecting to the resources that a entrepreneur would look at.
Mm-hmm.
What do we have the linkage to those resources today for financial, legal, whatever those are? And then what's the process for them to link in or be, is there any validation that we're doing to say this legal firm, this financial firm, these firms that are willing to be, are we as the county doing any validation of the ones we put out there? Are they ones that we'd stamp and recommend, or are you using them at your own risk, or what's in it for the county as far as the liability piece of this puzzle if we start putting companies out there?
Do you want me to answer what we?
Yeah.
Okay.
Go ahead, and then I'll.
Then you'll fill back.
I can
He
fill
backfills
anything.
the things I forget.
Good.
So the way it's been working with lifting up beef, like with the Morton Chamber of Commerce, of course, the ones that they're sending to are chamber members. But lifting up has contacted those people, first of all, to make sure that they're willing to take these types of clients, right? Not all accountants want to work with startups, right? So that we're not wasting anybody's time. They also have to commit, in order to be on the platform, to having one person that will reply in a reasonable time to these people. So if I say, hey, I'm interested in meeting up with you, there's someone from that firm who will meet with the entrepreneur. And so we're going to have something similar here, where lifting up is going to help us make those initial contacts and keep those things up to date. I don't have a gold star verification process. I don't know if that's I don't know where we are on that, Scott.
I'm not sure there is one. I think there's at some level there's known service providers in the community that are interested in working with startups, and those that aren't. And those that are interested, they're known. They provide some value of service, and that's where we start. Because from an entrepreneur's perspective, you don't want to go spend thousands of dollars in legal fees to set your company up with the wrong type of structure, whether it be a sole proprietorship, an LLC, an LLP, or an S corp, or whatever it might be. You want to have someone who understands those startups and can provide you with the good advice on that, on insurance, on financial advising, and on marketing as well.
Others? I appreciate this conversation. Thank you for your ongoing leadership in this, Dr. Glenn, and thank you, Scott. Are there any other questions? All right, we'll go to the loan resolution. Can I get a motion to approve an intergovernmental agreement establishing a public health equity firm? Thank you, Randy. Thank you, Sharon. Mr. Sorrell and I had a chance to discuss this a few weeks back. It's not exactly a straightforward conversation, but it was by the time we got through talking about it. So it's It's all yours, Scott.
All right, thanks, Mr. Chairman. And Monica and I are going to tag team. Monica's got I'll kind of tee it up, and then Monica's going to walk through the slide deck that, quite frankly, she authored, but Patrick and I had input on. If you recall, during the budget process, we appropriated $600,000 of ARPA funds for this purpose. This year, the city matched that dollar for dollar, so there's currently $1.2 million out there waiting to be used for this purpose. The resolution before you and the intergovernmental agreement attached to it are really the administrative mechanism that creates the fund itself, creates the administrative oversight, knowing full well that there are several other components that still need to fall into place. So that's just a very high-level generalization that I'm going to now turn over to Monica to let her walk through the slide deck.
Scott. And I did make copies, so hopefully all of you have access to that as well. So first and foremost, I always like to give out a slide just regarding what health equity is. Many of you may be familiar with these images. Both are from the Robert Wood Johnson Foundation that speaks and kind of distinguishes between equality and equity. Equality really talks about providing the same standardized resource across the board, and equity really is focused on making sure everyone achieves the highest level of outcome. I might have shared this story with you, and I apologize, but I always think of it in my own personal life as having two small children. And I work in public health, and they know Dr. Bishop, our dentist. They brush their teeth twice a day, and our bathroom has like a little small IKEA footstool for them to actually reach the water, the toothpaste, all that good stuff. My oldest does not need that step stool. My youngest definitely does. And so twice a day I hear an argument about who gets in because they're young. The best argument is I got there first versus you had it yesterday. But the issue is from an equity standpoint, well, from an equality standpoint, they all have access to the same resource: clean water, toothpaste, toothbrush. From an equity standpoint, my youngest requires it to actually make everything into the sink. I bring up this story because while these two images kind of share the same storyline, they fail to talk about what happens when my youngest does not get the footstool, and that is toothpaste is found on the wallpaper, on the vanity, actually on the floor where like the tile and the carpet meet. And so my husband and I then end up spending more time, resources, and money correcting for inequity. And I think that's what the focus of this fund is that we oftentimes focus on equality, and then we'll end up spending our very limited resources addressing or correcting for inequity over and over again. So with that in mind, the purpose of the fund is really to intentionally fund equity within our community, and actually as a method versus an actual outcome. And so that means sustaining and integrating improvements related to health outcomes, the ability to reinvest funds that might come throughout this process for further interventions or policies, build capacity and skills within our community to continuously work towards inequity improvements, as well as with the amount of funds that we're looking at, we can quickly and directly impact people in a short amount of time. And then lastly, and most importantly, that it'll be data-driven and evidence-based. So when we talk about where we would be putting funding towards the American Recovery Plan Act dollars, as well as the direction would be around those social determinants of health. So this is from Healthy People 2030, which looks at really the 5 categories of social determinants of health, or SDOH, and that looks at access and quality to healthcare. That means availability, different types of insurance methods, even providers' education base in terms of making sure that they're doing trauma-informed care. Neighborhood and built environment, so the physical space, we're looking at sidewalks, housing, aspects of those. Social and community context, neighborhoods, the feeling of inclusion and safety, as well as economic stability, and then lastly, educational access and quality. So those are really the 5 buckets when we're talking about addressing inequity, what we should be focusing on. So this is a joint venture between the city and the county's ARPA dollars. We are looking at, by putting this money towards and specifically addressing that, we could really address systemic issues related to public health as well as economic challenges. Again, the ARPA dollars and the U.S. Treasury up front listed the fact that there are neighborhoods and communities that were exponentially impacted by COVID, and that disparity really exists around the inequities that they have systematically faced. We hope that this is actually a return on investment approach, not necessarily dollar for dollar, but by actually addressing inequity that downstream the resources that we save for going towards retroactive types of interventions, we could actually use that to further continually support and invest in this, because this could be seen as seed money, really development money, and then have less of a cost to maintain over time. But the impacts of it we could see in our public safety sector, our public health sector, and our education sector as well, just to name a few. So why city and county funding? It's really because, one, both the city and county have been very upfront about wanting to address equity with last summer creating the Racial Justice and Equity Commission. And by leveraging it as a city and county, you're able to leverage two funding sources. We do recognize a lot of the data we've produced, and I know many of you were in our meetings around our Health and Human Service Campus one, that they are concentrated in areas of poverty, which is primarily just by population numbers in the city of Peoria, which of course is in the county. But by doing this shared approach, we also eliminate redundancies. So it's not that the city is doing something singularly or the county, but by actually, one, starting with a shared funding stream, then we can actually collaborate much more intentionally. So the city actually, with their 2-year budget, they allocated $600,000 each for the Health Equity Fund, so for their 2022 and 2023. And then likewise for 2022, the Board of Health, the County Board also allocated $600,000 as well. So to Scott's point, we already have 1.2 for this calendar year right now. So how we would go about this and utilizing this funds, again, we'd be using data to drive a lot of our decision making, as well as the existing infrastructure we have. So I will share this, but the two links that are listed there under what is inequity, and I don't know if Scott can share those or not, those are examples of both a national indicators as well as a map from San Antonio, where they actually mapped out using their census tracts where they saw the highest levels of inequity and where they would be geographically focusing a lot of their energies. Likewise, using the Racial Justice and Equity Commission to look at those indicators and what would be the driving factors that they would prioritize. Likewise, the health department, in partnership with the hospital systems, OSF St. Francis Medical Center and Unity Point Health, we conduct a community health needs assessment and improvement plan every 3 years, where we do determine what are the top health priorities. So between the Racial Justice and Equity Commission, as well as data from our CHNA and CHIP, we would be really looking at those are the areas where we would want to focus a lot of our funding and interventions on. In terms of accountability, for the purpose of this, and I think it's also listed out in the IGA that is in the packet, the health department would serve as the administrator of funds. This is very similar to, for example, our Edwards grant that we received. The health department does the administrative, the oversight. We do the report outs to government, or in this case, different agencies or different councils possibly. So we would be the administrator of that, but overall the driving force about criteria and those grant agreements would also, kind of specify what those operational pictures are. So again, we hope to develop that as the next steps in this process. The other thing that we are very cognizant about is that there's a lot of other funding coming out right now, so we want to make sure that the funding that comes through for this fund works to supplement and support where possibly other funding areas have gaps or maybe are too restrictive. So while we know that DCEO, ICEJA, HUD, the Federal Infrastructure Bill, even IDHS, and our routine budgeting has funding allocated out for some work around this, oftentimes there's a lot of limitations. While ARPA dollars, because of how they're listed for census tracts that have extreme disinvestment, it has a little bit more flexibility in this grant. So part of it would be supporting this. we know a lot of these grants are coming out of the summer, so our criteria would be working to not compete against this and not be necessarily a primary source, but a supporting source to help back a lot of these efforts, or where we might see specific gaps in our communities. Oops, sorry. And this is the tentative timeline. So I think Scott and City Manager Urick, we've been meeting since October to start talking about this process, especially after both City Council and County Board budgeted for that $600,000 each. We started working on creating and defining with the RJEs as well as the intergovernmental agreements, kind of where we're at. This May, the community health needs assessment will be complete and the priorities will be identified. Actually, it's going to be May 25th, I believe, so a month from now. And then we'd be working to get the criterias in place so that we could start possibly announcing awardees as early as December of 2022. Now, timelines might change drastically through this process. We recognize that. Again, we want to make sure we are looking at this and taking into account a lot of the reviews that are going on with the Racial Justice and Equity Commission as well. So really high level, more than happy to answer any questions.
So this would be awarded to organizations already doing something involving equity, or is there something new that we would be seeing?
It could be possibly both. So it could be awards to agencies that support one of the intervention points, or it could be an agency that has recognized a gap and needs to support that. So not this specifically, but for example, we know there is a housing issue in Peoria. It's affordable and habitable housing that's an issue for a lot of families. So our emergency shelters are well equipped to be emergency shelters, but to have that step out of them does not exist in our community. So it's very limited. So it might be that we are helping with putting money towards development, a capital project for housing, improvement projects, making homes up to code. Any of those could be possibilities in this fund.
Mr. Dell?
Monica, so that would be 1.2 million available from the city, from 600 from us and 600 from the city.
Yes.
So is this something that we talked about administration, is this something that the health department is taking on just in their current role, or is there administrative costs?
I think depending on the scope and the size, what we would be looking at is there would be some administrative costs just to cover maybe like 20% of a staff time or 10% for all the reporting that we'd have to go back to the Treasury for, as well as to City Council, County Board, and of course the RJE. But the primary funding would be going to awardees. So again, similar to our Edwards grant is the best example I have. Even how we run our care and treatment board, right? So the health department is a fiscal agent for that. So we do have some administrative processes that we do in play, but majority of it is straight out into the community.
And is there guidelines, similar like what Jennifer asked about new versus existing programs? But let's just say I'm a social service agency coming. Are you capping on how much money certain groups can get and planning on giving out all 1.2 million right in the front a year, or holding some back? Just kind of curious of what you're.
So I think that's still up for debate and discussion. The first step is to get this agreement and this formal process started. But I will say my vote, and I can't speak to the RJE or to county board or anyone else, is that this is such an impressive amount of dollars, and the way it reached through the Treasury is there's a lot of flexibility on it. What I would hate is that also from an administrative cost to be giving out 10,000 and 15,000. I think these should be substantial grants, at least six figures that go out, partly because of control over it, but because it can make a meaningful impact when you're looking at trying to address. If I go really quickly through this, these social determinants of health, because these are not small issues to address.
And you'll get metrics back from each program?
Yes. So we hope that through the grant making process that we would be looking at not only outputs, but also outcomes. So we want to make sure that they are moving the dial or have strong enough data points to determine where they are addressing this. So it could be something as looking, because it's a 4-year ARPA dollar, and we're hoping it's a 4-year program, that if we're looking at early childhood education, so someone that needs to expand classrooms so that we have more children, or do a voucher program so low-income children can be placed in different early childhood care programs, so you can see 3rd grade reading or kindergarten readiness as a measurement that you see change on.
Very good presentation. Let me go to the phone and see if are there any. Is there anyone on the phone who has a question for Monica?
No, thank you. I don't have any, thank you. No, thank you, Monica. Does Phil know?
All right, great.
I will
Monica.
just add one more point. City Council meets tonight, and this is also on their agenda as well.
I have one question.
Thank you.
Can
Go
I
ahead.
ask one question? As an example that you gave for child care, would that have to be a organization or could it be home daycare?
It could be both. And again, ARPA, we're going to rely heavily on the state's attorney to review the Treasury documents, but having read the 400 pages myself, just only once, it does allow for daycare, licensed daycare, so it could be a home base. Voucher programs aren't eligible cost, but it's depending again on neighborhoods of inequity. So it can't be in maybe one of our high income neighborhoods. It would have to be focused in those neighborhoods.
Right. Any other like qualifications or requirements that they would have to have?
No, the biggest one is going to be based on
equity.
Was it census tract?
Qualified census tracts.
Qualified
Thank you.
census. Okay.
Good question. Are we all done? All right, so the motion on the floor is for an intergovernmental agreement to establish a public health equity fund. All those in favor, please say aye.
Aye.
Aye. Aye.
Aye.
Linda? All right, any opposed, same sign? All right, we'll count that as unanimous. Congratulations. I'm going to go through the standing committee call-ups based on the way they are in your packet. So beginning with Mr. Renaud.
Thank you, sir. We have the joint resolution, which I think everybody got a full view of just a little bit ago through finance for the pandemic pay. That passed through operations unanimously. And then Becky had 2 grants that she received. The first was an appropriation from Petco Love, and that was a $10,000 grant that's going to be used for medical expenses, stocking some of the trucks so that some of the animal officers will have things to give to pet owners in need, and then also for intake diversion. And then the second appropriation was for the Community Foundation of Central Illinois. It's a $5,000 grant, and that is for medical expenses. Specifically, they're going to use them for vaccinations. The animals that are under their care are more at risk for certain diseases, so this will allow them to give them vaccinations every other week to reduce that, and of course that makes them more adoptable. So she's still doing an outstanding job there getting grants for us. And then the last resolution was setting the elected salaries, the ones that are up for the next term, and that would be the county clerk, the treasurer, for all board members, for the chairperson, and for committee chairs. And then the last one is for the sheriff's office, but the House actually in the General Assembly passed a bill and it was signed into law that the sheriff's salary will be set at a minimum of 80% of the state's attorney's salary, and then the state will pay 66% of that salary. So I am happy to sit down with anybody who wasn't at the committee, and I can kind of show you how we arrived at the numbers that are in there. If anybody has questions, I can run through now if anybody wants to, but I'd be happy to sit down with each of you who weren't there and go through those numbers with you. So,
Do we understand what the motive is for the state to set the salaries of the sheriffs?
I do not.
Well, I
It's
should say create the percentage formula.
it's some. They recently had said it for the public defender also, that it would be 90% of the state's attorney's salary. Now they're doing it for the sheriff, so
Are those minimums?
it's a minimum. But we set it at 80%, which is a 2.9% increase.
But those are minimums.
And then it would fluctuate each year as the General Assembly assigns or chooses to or not to give raises. It would fluctuate.
That 66% cost sharing, is that per term or is that per budgeted year?
I'm assuming year.
Per state fiscal year. So half of it, that splits our fiscal year.
And then we did put within the resolution, we set the salaries for board members, committee chairs, and the committee chairman for 10 years. But of course, statutorily, it can be changed every 2. It's just that the board, it would change for half. And then the next 2 years, it would change for the other half if they choose to, just because of the way that we run. But since the census and we're all running, it would set it for all positions at once.
Any questions for Rob? All right, infrastructure, Phil, or whoever's covering for Phil.
Hey, Mr. Chairman, because of the circumstance of me being on this phone, I asked Jimmy Dillon, who's a member of our committee, who's very informative, and he's going to handle these 7 resolutions, the first 5 being from the county highway and the other 2 from county administration. So I thank Jimmy for doing this for me.
Thank you, Jimmy.
So, Coach had quite a few resolutions on his agenda and discussion items, but first one was engineering services agreement with various land serving services. So that's basically a 3-year extension because we don't have surveyors working for us at the highway department. That was with Mar and Kerr for, I believe that was only up to 30,000. Financial commitment of local funds for reconstruction of Sheridan Road. So this is a PUATS thing that would have to go through. So even if we get selected for that, you needed a letter of support. So even if this project would get approval through PUATS, you're still looking at 2026. Rob asked for when that would actually, so 5-year outlook. Intergovernmental agreement, 4-year. Intergovernmental agreement with City of Peoria for highway structure inspections with the city. We handle the bridge inspections for the city because they don't have a ton of bridges. Motor fuel tax appropriation for guardrail repairs. So we had some accidents and we have a new section down by Lauterbach Park that we would have to put in. There was some new pickleball courts installed and a car's already gone off and damaged the park. So the asked for some new guardrails there. That's about $250,000 worth of guardrails. We do recoup, I think she said about a 15% average for insurance purposes, but that we can only go after insurance if there's an actual report of somebody hitting the guardrail. Motor fuel tax appropriation for Cedar Hills Drive payment resurfacing. Extension of our contract with Peoria County Courthouse Fire Alarm Inspection contract. That is with Johnson Controls. It's their system. They come in and test fire alarms, and by having that agreement, there's a discounted rate on their service call rate. And then Peoria County Jail Competitive Large Incentive Project. That is with ECSI, which is the control side of rural, and that is a bunch of miscellaneous projects, a bunch of different projects out at the jail. And then we had the discussion, just to be prepared, from finance about our fuel budget. So obviously the cost of fuel is considerable, so we just had that discussion. And that usually comes as a joint bid with the city of Peoria.
Thank you. Any questions for either Phil or Jimmy? All right, Ways and Means.
Ways and Means, we had informational. I'll make a comment on one, just as awareness that the Election Commission's having a press event on Friday this week on the new election equipment and the process that goes with it. So it's more of an awareness. We did not have any resolutions on the committee this month.
Thank you, Mr. Ritter. Any questions for Ways and Means?
I saw that. Do you know what time that is?
Love it.
11,
I think it's 11.
11 a.m.
Okay.
So it's open to the public and for the press to come in and understand.
Thank you.
Thank you. Mr. Dillon?
We had one zoning case, and it was the petition of Nate's Awesome LLC, but it's basically the land out by 91 OSF and by the data center. It's one of the hairs that it used to be a pilot that has a little private plane, and someone on that ground that they own out there would just like to be able to land the plane. OSF did object prior. No one came to the meeting from OSF yesterday to object because it's been unanimous through all three stages. He does have FAA approval and IDOT approval, which were all boxes he needed to check prior to submitting.
Thank you. Any questions for Mr. Dillon? We'll go to Sharon Williams. Hi, Sharon.
So we had one resolution, which was the Health and Human Service Campus Site Location Policy Decision. Over the past several weeks, we've had small groups to talk about various stages of this project, but we finally, this last third was about where we were going to locate. So we went through a lot of data, and after the data was compiled, the site where the current health department sits now is the location that was chosen. So that vote passed with just one nay.
Any comments for health? All right, I assume we don't have Mr. Fennell's committee in the packet. Did I skip over you by accident?
I don't know if
Back
by
page,
accident.
there it is. Sorry.
We had one resolution, it was the one Rob talked about, it was a joint resolution for the budget amendment for the pandemic premium pay. We had one dissenting vote, and otherwise it passed.
Thank you. Congratulations on that, Rob. All right, we'd be at miscellaneous. And at 22.
Just real quick,
Mr. Ricker.
RJE, is there any updates that could be presented in a future meeting, just the status of how that commission's progressing? Because it's been in formation for approximately a year now.
Yes.
Don't know if there was a cadence in the original of report out. If there is, we'll use the cadence. If not, ask if maybe an informational.
Would you be able to discuss that with us, Randy, as
Right
a
now?
member? Well, you can
No.
give a brief
Oh, yeah.
update, but if you'd like, at our
Well-
next meeting.
Yeah, next meeting.
Okay. All right. You bet. All right, any other business for the executive committee? Seeing none, I will adjourn. Thank you those on the phone. Sorry you couldn't make it. It's a lot more fun.